Hello. Yes, it's another Sunday evening in Lagos, Nigeria, and you're welcome to Dr. Abayomi Ajayi live. My name is Dr. Abayomi Ajayi, and today, we started the new year on a very positive note. We had Mrs. Myla sharing her success story with us, and today I promised that we're going to talk about your guide to having a baby in 2021. We all know by now the definition of infertility, that is the inability of a couple to achieve a pregnancy or a live birth within this time period of 1 year. And we always say that if you're above 35, 6 months is enough. If you are less than 35, then we talk about 1 year. But today, in order to help us, to guide us through this talk, it's a guide through to having a baby. We're going to take it from two dimensions. We're going to look at people who are trying to conceive naturally, okay? And then the people, either they've not had a diagnosis or they're just trying to achieve a natural pregnancy. And then we look at people who already have a diagnosis that they know they need IVF, what they need to do in order for them to be able to achieve their dream for this year. So come along with me, okay? We know that fertility is very inefficient in the human. And that if there is no problem at all, if 100 couples decide to have a baby, in 1 year, about 80 of them will have a baby. And in about 2 years, about 90 of them will have a baby, or will have babies. We also know that lifestyle, by now we know that lifestyle impacts on our fertility. So where we start from will be the lifestyle, all right? So, but this, like when we're talking about lifestyle, people don't take into cognizance the fact that the age at which you start a family is part of your lifestyle. It's a decision you need to make. Yes, as we go along, we're not insensitive to the people who are probably advanced in age, but they don't have a life partner yet. We're going to also take care of them. So, but if within your control, please start having raising a family quickly. Alcohol consumption, we know, affects both men and women. Cigarette smoking, use of recreational drugs, we know. And we also know that body weight, your body weight also affects both men and women. And we also talk about avoiding sexually transmissible infection, okay? You can use contraception, barrier contraceptive, for example, if you know you're not ready to raise a big family yet. But what we're going to start with is the issue of diet, all right? What we say, you are what you eat. So if you're trying to achieve conception naturally, it's important for you to eat food that is rich in antioxidants like folate and zinc, because this have been shown that they might improve fertility in men and women. So fruits like vegetables, nuts, and grains are packed with antioxidants. So you can use vitamin C, folate, and beta-carotene. But this is, I'm not saying that this is the treatment for infertility. I'm talking about, what we're talking about are the things that can promote fertility. Please avoid trans fats. Trans fats are usually associated with increased ovulatory infertility due to their negative effect on insulin sensitivity. Trans fats are usually found in hydrogenated vegetable oils, fried foods, and baked goods. So the cake and all those things, take it easy on them. And if you have a polycystic ovarian syndrome, please cut down on your carbohydrates. This, of course, will help you to maintain healthy weight and reduce insulin levels, which will make your menstrual period to be more regular. It's not only the quantity that we're actually talking about, but we need to be careful about refined sugars, as in sugary foods and drinks, rice, pasta, because this really, they are quickly absorbed into the bloodstream and can cause spike in your blood sugar. You rather please eat food that are rich in fibers like avocado, rich sweet potatoes, oats, and of course fruits. And try to swap your protein sources Replace animal protein like meat, fish, and eggs with vegetable protein like beans, nuts, and seeds. And of course, you need to get active. Okay, you need to do a little bit of exercise, you know. So you need to reduce your stress level by taking time to relax. Then if you like to throw in things like yoga, acupuncture that might help you to reduce stress and anxiety, this is also welcome. And please cut your caffeine. What is allowed is not more than 500 milligrams of caffeine. It's about 2 cups of coffee in a day. If you can do without, so good. But if you cannot, like me, it's okay. But please do not exceed 2 cups of coffee in a day. All right. Now, let's go to another one, which is apart from food, which is also important for natural conception, which is sex. And when it comes to this, there are so many myths and misconceptions about how to and when to have sex. All right. And let me start straight by telling you that there is no evidence that any sexual position or prolonged rest after intercourse or lying in a particular position after intercourse affects fertility rate. So there's no point you have to lie down for 30 minutes after sex. You have to put a pillow in your bum to raise your bum up. Those things are just old midwives' tales. However, it is better to avoid most commercial lubricants when you're trying to get pregnant, as majority of them, especially the oil-based one, will affect sperm function after ejaculation. Mineral oil and water-based lubricants can be used. All right. Now, the other question is I'm often asked is, how often should we have sex? And I say most of the time that there is no straight answers to this, but studies have shown that couples who have intercourse at least 2 times per week increase the probability of pregnancy. Studies also show that prolonged periods of abstinence from sex tends to decrease sperm quality in men. I've seen some men who say they're trying to save their sperm and will not have sex for about 2 weeks, 3 weeks. It's no work done, actually. So that's why when we're asking you to bring sperm for testing, we say don't abstain for less than 2 days, but definitely not more than 5 days. Then also people ask, when should we have sex? When is the fertile period? That's probably the most asked questions about when people are trying to conceive. And I say that intercourse is best just before your ovulation if you're trying to conceive. But the million-dollar question is, how do you determine when you're ovulating? Okay. Right now, I think life is much easier. There are ovulation kits that you can buy over the counter, and this usually. But you can also calculate this even if you're not using any kits yourself. If you're doing this, if you want to calculate yourself, what you probably need to do is take an exercise book or something and write a pen and track your menses for 3 months to 6 months. So you will be able to see how many days in between one cycle and the other one. And then, from there, you probably will be able to predict when the next one will be coming. You know when the last one happened, and then you will be able to predict when the next one is likely to come. When you can do this, because one thing is certain, that you are likely to ovulate 14 days before your next menstrual period, okay? And your fertile period will probably usually be 7 days before your next ovulation. So that way, so let's look at an example and say, let's say your last menses was the 2nd, okay? And you have seen over time that you have about 28 days in between one cycle and the other. So probably the next one is going to be 29th, all right? So you can look at that, you're likely to ovulate around 15th, all right? So if you say 7 days before 15, that's from about 8 to 15 will be your fertile window. And then you can have sex alternate days. But usually this is no longer necessary, because what we recommend most of the time is that if you can have intercourse 2 to 3 times in a week, then you're likely to have intercourse when you are fertile, okay? Well, one thing that we know is that timing is important in trying to get pregnant, and that's why is timing important, because we know that the egg only survives about 12 to 24 hours after ovulation. So it's always important. It's better, it's more efficient when the sperm is ready and waiting, because the sperm is more, let me say the word, and use the word, is more rugged in that it can stay for about 2 to 5 days. So it's better that the sperm is already waiting by the time you're going to release the egg. But if you have intercourse 2 to 3 times in a week, everything is should be okay with you. Now, that's for people who don't have it, who are not known to need IVF, but who are trying to get pregnant naturally. What about people who already have a diagnosis and they know that they need IVF? What should they do? I think one of the things, if you want to get pregnant this year or achieve your dream this year, one thing I need to tell you is that please do not procrastinate this year, because we know that success rate of treatment depends on the age, particularly of the woman. Yes, the man also, but more of the woman. And we can make reference to the report that was released last year, July, by the Human Fertility and Embryology Authority in the UK, where they revealed the result for 2018 for the whole of the United Kingdom. And they saw that women below 35 years had the best birth rate, which came at about 31% per embryo transfer, while women above 43 had less than 5% birth rate per embryo transfer using their own eggs. And so that's why you see in IVF clinics, sometimes we advise women, especially when they're about over 40, that they might need to use donor eggs. We know this is not a very easy decision to make, but it might just be the most prudent, because when you use donor eggs, the live birth rate goes back to about 25% per embryo transfer. But also the figures in the UK shows that it's only about 18% of women who are above 40 who were able to use donor eggs in 2018. So majority of them still stuck to using their own eggs. But you know, it might be easier for them than in our own environment, because in our own environment, yes, I know it's not, there is the fact that it's not, the treatment is not free completely in the UK as well. But if you live in some areas, you might have some part of it free, either the drugs or whatever. But in Nigeria, there is no part that you have free. Everything you pay out of pocket. And what I tell people is that it's important for you to be making the right decisions, especially in our own environment where every dime comes out of your pocket. The other thing I would like to advise people who need IVF is that they should be choosing the right fertility clinic. This is a very important topic, and I'm sure we've discussed this before on this program. So if you have the time, you can flip back and see some of the past topics on this program where we talked about how to choose your fertility clinic. But one thing I want you to know is that this choosing your fertility clinic is not something that you do on the telephone, because you need, most of the time I hear people asking how much is IVF in your clinic, and that is the basis on which they want to choose their care provider in fertility. I don't think that is right, because you need people who are compassionate. You need to choose a clinic that where the staff are compassionate, where there's clear pricing about the procedure you are going to do, and they have exceptional emotional support. Sometimes other ancillary services like a very good counselor, or a department of the counselors. They have quite a number of counselors, and sometimes even things like acupuncture might help you to relax, because the treatment, just like infertility itself is not a tea party, the treatment also can be emotionally draining. So it's important that you have the kind of emotional support that you need. One other thing that many people don't like to hear, but which I will not stop talking about, is the fact that you must prepare, if you want to do IVF, prepare for more than one cycle. So we talk about you preparing for multiple cycles. Yeah, and because of this reality, many clinics have rebates on upfront payment. And of course, also if you succeed the first time, you can collect your deposit, your money back. So many clinics do that. Why do you need multiple cycles? We know that IVF success rate is cumulative. Yes, you might be lucky the first time, but if you are not, you might need to do more than one cycle. And then in one cycle also, in one pickup, you might be lucky to have excess embryos from a single pickup, especially in younger people. And there's some people that even in this clinic that have had 3 pregnancies from one single ovum pickup or embryo pickup. And sorry, I'm saying oocyte pickup. Or sometimes if you don't even make enough eggs at one go, you can pull your eggs together and have many more embryos. Because see, this thing about success of IVF is really about the quality of the embryo. So the more that you have, the better for you. And the quality of this embryo is actually matters a lot. So if you can do 2 cycles or so or 3, for example, especially for people who are doing some procedures like pre-implantation genetic diagnosis, might be important for them to pull embryos together. And that's where also the freezing facility of the clinic you're using matters. So seriously, I don't think if you really want to succeed, you're not just a shot from the blues, then you need to be looking at some of these facilities before you pitch camp with the clinic. Then also, there's some people, I said, if you don't have a partner yet, it's not all lost for you. If you want to freeze your eggs in 2021, it's the right time to do that, because we know that fertility decreases with age. So if you know, for example, you're nearing 32, 35, and you still don't have Mr. Right, there's nothing wrong with you storing your eggs until when you're ready to use them. And if you, even when you're ready, you don't need them, then that's another discussion in the future. But it's always like insurance. You can always insure that when you need them, that's not when you're going to be looking for eggs in another person to donate eggs for you, because you are probably over 39 or 40. So, but this discussion in 2021 will not be complete if we do not talk about COVID-19, because that happens to be the elephant in the room now. And many people are asking so many questions. Can I get pregnant in 2021 in spite of the pandemic? And the answer is yes, you can. The WHO declared COVID-19 a pandemic in March 2020. And every professional body regulating the practice of infertility treatment just first said, because we didn't know what was going to happen, this was a viral infection. Is it going to be like a Zika again? Nobody knew what was going to happen. So the first reaction was stop. And then, but once more data was gathered about the disease, as much as they could gather, because don't forget that COVID-19 is just 1 year old with us, just a few months after 1 year. So the first one was, of course, was reported in China in December 2019. And that's why it's called COVID-19. So, but now all the professional bodies have come up with guidelines for the safety of patients and staff in fertility clinics. And some of these things. So sometimes don't be surprised when you want to come to a fertility clinic, you get a phone call the day before and they're trying to ask you, do you have a fever? Do you have sore throat? Are you coughing? They're just trying to triage, because we, as much as possible, that's where the guidelines start, trying to triage the patients that should come to the clinic, all right? And so we try to limit the number of people who gather at once. That we know that anything that gathers people together can be a super spreader event. So we try not to bring so many people together at the same time. And so appointment is very, very important at this point in time. I know that's a funny thing with Nigerians. They still find it difficult to keep appointment. We talk about traffic, we talk about everything. But this period, it's very, very important that we should please keep to the appointment. That's why sometimes when people come too early, they're told to wait in their cars because we want to limit the number of people that are in the waiting room. And then again, face covering is so important. When you're coming to any fertility clinic, please come with your mask. And I'm sure many clinics also, if you don't come with your mask, they will provide you with mask, because seriously, we know that COVID-19 is real, okay? And then most clinics now will have done what we call physical distancing, arrange their chairs in such a way that people don't just sit close to one another. Because these are all the things, we want you to be healthy, we want our own staff also to be healthy, and that's the only way all of us can go on in this trying period. And of course, please do not forget the personal hygiene, washing your hands, using hand sanitizers, and in some other instances also, especially during oven pickup, then the care providers are advised to use things that will protect them. And now to maximize this distancing, we're doing a lot of video consultation, you know. But you know, some patients still want this face-to-face thing. But this is the way the life is changing now. That's what COVID is doing to us, that we might have to do the things that we don't need to sit down face-to-face in order for us to limit this human-to-human contact, because we know that that's what spreads COVID-19. And then also the frequent testing of staff and patients, so that we can diagnose asymptomatic carriers, you know, because we know that about 40% of the people who have COVID-19 are asymptomatic carriers. So, and then, but also these guidelines recommend that if you diagnose COVID-19 in a patient that is already undergoing stimulation, you should stop treatment. But if your diagnosis comes between when you have picked up the eggs and you're waiting for transfer, then you can freeze the embryos so that the patient gets well. And this is, we're coming across this a lot, but we're also coming across patients who are holding information, who are not telling us even when they have fever, until you are in the consulting room, you see that somebody is coughing. And then we now start asking questions, and you see that, oh, there is the husband is either already ill or something like that. So it's important that people volunteer the information. I'm sure you don't want your carers to be sick, just like we don't want you to be sick too. One thing we know is that there is no stigma. We should not be ashamed of this COVID-19, because let me tell you, anybody can have it, because it's not something that you have done. It spreads more in the air. There is also contamination. So all of us are open to it. But what we're trying to do is that it will be disastrous when all of us fall ill at the same time. So it's important that we just make sure that we limit we limit the people who come in contact with it. And that we can really do by, if you help me to keep safe, I also help you to keep safe. And that's why we're always talking about use of face mask and shield. Now, one thing I need to tell you is that there is no evidence currently that there is any negative effect of COVID-19 on sperm, eggs, embryo, on fertility treatment, and even early pregnancy. Yes, there was a small study that showed that there was viral RNA in 6 out of 38 semen samples of men who recover from COVID-19. There's still no evidence of sexual transmission or direct infection of either gametes or embryos. So there is also a data that might suggest a low rate of vertical transmission in late pregnancy. But up till now, there is no reason why you should stop your fertility treatment. This is not Zika. And pregnant women are not more at risk of contracting COVID-19. And pregnancy has not been shown to affect the rate of death from COVID-19. You know, so you can go on with your treatment. But one thing I want to always say is that counseling is very, very, very important in patients who are also facing infertility, and who test positive to COVID, because yes, it's a double whammy, as it were. You know, you are facing infertility, and then you also have you test positive to COVID. The two are emotionally draining. And so it's important to seek and to get, please, a lot of counseling to help you go through this. You know, the good thing, well, I say that with a sense of responsibility. One thing that we don't say so much about COVID is about 80% of patients people who contact COVID will not show any serious symptoms. So is not a, COVID per se is not a death sentence. The only problem is that we don't know who the people who are going to die when they have COVID. That's why we're saying that please let us not spread this. And then don't let all of us come down at the same time with this, even if you're going to finally get it. But it's something we're going to live with for a long time. And there is no point, there is no reason for us to have a sense of stigma about having COVID. There is nothing, it's not HIV. It's something that you can get by just breathing, by you breathing. So, and all of us, we know all of us breathe. I'm just going to ask some questions before I go to the big thing, which is the vaccine, because there seems to be a lot of misconception and misinformation about the vaccine. So I'm going to spend the last few minutes about the vaccine and when you're about fertility and infertility. Okay. Yes, I'm trying to read some of the questions. I call my sperm wide. Good evening, doctor. I'm battling with severe oligospermia for many years. I tried IVF ICSI last year, which failed. According to the embryologist, my sperms were able to fertilize my partner's egg but stopped developing. He made mention of sperm DNA fragmentation. What is my chance of success? I'll be 34 and my wife will be 30 soon. Okay, we know that sperm is responsible for the early development of the embryo. Okay. And therefore, it's possible that, well, if it's severe oligospermia, it's possible also that the embryos might stop developing. But what we can also do is to have as many embryos as you can have. Yes, you can do sperm DNA fragmentation. We've done that. We've done studies on that. It's going to be difficult for me to be able to tell you what your chances without getting all the results of your test results, and then that will. But I'm happy to help if you consider that I can help you. This is another question. If I'm on birth control, please, how soon after stop taking them should I begin to get pregnant? Oh, before we used to say you should stop. When you stop, then wait for some months. But you know now, anytime you stop taking your birth pills, control pills, you can start trying to have a family. So you can start anytime when you have stopped the birth control pills. Will a previous miscarriage affect my chances of conception? One previous miscarriage is not enough. So we can't say you are a recurrent miscarriage. That can happen from to anybody. So I cannot say from one just previous miscarriage that it will affect your chances of conception. What are my risks with conception if I had a prior ectopic pregnancy? Okay, this is a prior ectopic pregnancy might also mean that you are at risk of having another one. I think it's about, you have a 15% chance of having a second one. But the most important thing is that when you get pregnant the next time, it's important that the doctor looking after you should go to see how to locate where the pregnancy is early enough so that we can see whether it's a recurrence of an ectopic or is a normal pregnancy. But you can get pregnant right in the right place. How will an existing medical condition affect my chances of pregnancy? It depends on what the existing medical condition is. So I might not be able to answer that. What are prenatal vitamins? Why do I need them? When should I start taking them? How long do I need to take them? Okay, you're asking you can, vitamins are just supplements. So you can take supplements anytime you like. I don't believe in the very expensive ones. So if you're taking vitamin, we talked about the vitamin C, antioxidant. If you're taking those simple ones, vitamin B, and folic acid, it's okay. So, but I don't believe there's so many very expensive ones that actually sometimes you might spend the money for your IVF if you need one. on these vitamins. Do I need to wait if he had a surgery recently before getting pregnant? Yeah, this is not, I don't know how to come into it, but because I don't know what surgery we're talking about. What surgery are we talking about? So was it on, so Ademola Grace, I might not be able to help you, but if you have more questions and if you feel that you still want to ask more questions, you can always drop your questions at info@abayomiajayi.com.ng, and I'll be happy to answer those questions. Now, I'm going back to vaccines, you know. Oh, do we have some people on Facebook? You can't ask questions. I see somebody raising up our hands on Facebook. Can you please send a question so that we can answer the question? Because if we start allowing people to talk now, we might not just be able to get out of here. So I'm talking about vaccines now because that seems to be the topic now that is, I don't want to say that is disturbing some people, or because of no thanks to the conspiracy theories. Yes, if you are trying to conceive, if you're trying to get pregnant, you can take the vaccine, especially if you're in the vulnerable age group, like if you're a health worker, a social worker, or you have an underlying health condition. Yes, nobody has said that pregnancy is a contraindication to the vaccine. What has been said that there is no enough data on you taking the vaccine when you are pregnant, you know. So they're different things. Okay, you are trying to get pregnant is different from when you're already pregnant. And then it's even said that if you've taken one shot of the vaccine and you see that you're pregnant, you don't need to panic. You can wait until you have your baby and then you can take the second shot. So the vaccine, you know, especially when we know how the vaccines work, you know, most of the three first vaccines, that the Pfizer, BioNTech, the Moderna, and the Oxford AstraZeneca, they're all RNA vaccines. So hopefully they should be okay. And then the Johnson & Johnson is a viral vector. So they're using the common cold virus to introduce the genetic material into you. So, but this seems to be these are very interesting times. But like I said, if you're trying to, you can get the vaccine if you want to. The fact that you are taking fertility treatment does not mean you cannot. Okay, it's for people who are already pregnant that they say they should be careful about this because there is no enough data yet on these vaccines in women that are pregnant. Okay, and that's on this note. If you have any other question, of course, you know, I'll be willing to answer them. I hope I've been able to help you because the whole idea is to give you a guide to how to achieve pregnancy this year, 2021. I wish you a very wonderful 2021. I pray for you that it will be prosperous for you. And then by the end of this year, definitely you have your own bubble of joy to as a testimonial. Thank you so much for being part of this. Now see you some other time. Thanks.